Then he got put into Midlothian Hospital, which is the old Rodney Laing Hospital. It used to be up at the back end of Roosevelt, to get him rehabilitated, so to basically get him back in scratch for going back into a nursing home and get his medication properly right again. So it was making him a more peaceful, more easily looked after man, because obviously with his dementia and his psychosis, plus he was a semi-professional boxer and also he could be a wee bit hot-headed sometimes with that. So anyway, it got to the stage that they were wanting to move him before the pandemic kicked in, and they says, well, my mother had just died on the December the 13th, and they says, well, with Christmas coming up, blah blah, and my mother just passing away. It's not really the time we're grieving our mother, and they says, right, we'll give it, we'll leave you alone just now. In the meantime, look for some nursing homes. So we looked at some nursing homes, and a lot of them said, we don't want your father because we've not got the trained staff to look after your dad's needs, blah blah. So anyway, that got sort of put in the back burner, and then the pandemic came in. So
and Rodney, when the pandemic came in, he was still in hospital.
He was still in the Midlothian hospital. So he was kept in there. Everybody was in lockdown. So for 13 weeks, we didn't see my father for 13 weeks, and it was his 80th and that as well. We didn't see him because obviously everything was on lockdown, so we never got to see him. And then I got a phone call from his social worker. She says, Rodney, a wee bit of bad news. We're shifting your father. She says, you can't do that. It says the government said it's a lockdown. It's a killer elderly people. You can't do this. Basically, he's got to be kept in there because he's fit and healthy in there. He's testing negative on his tests, on his weekly tests that they were doing on the residents. And he says, well, unfortunately, we're having to move him. I says, you can't do that. And he says, well, we're going to overrule your power of attorney. The government is basically wanting as many people, elderly people, back in the nursing homes due to the fact that they're wanting to use a lot of the hospital spaces for COVID. My sister got back to the social worker and says, you cannot move my dad. You cannot move my dad. This place is it's ripe for COVID, and you're basically going to send them a death sentence. And they said, well, unfortunately, so it's out of our hands. He's getting shifted. So that was on the Thursday, and it was shifted on the Tuesday.
Just past the peak of the pandemic, your dad's in hospital being tested negative for COVID. Is that right?
Negative, fit and healthy. Within a matter of 3 weeks and 1 day, passed away. And then, as I say, within 3 weeks and 1 day, he passed away. And had to die on his own with a bunch of strangers. And it was just terrible.
Yeah, and as I understand it, you think there are certainly a couple of bodies, maybe a couple of people who should answer to this. One is, you think the Scottish Government should answer to clearing somebody away from a hospital ward to a place of danger. Is that right?
You just wouldn't do that. It's a biohazard that comes under a biohazard. When something as serious as that you contain it. You didn't shift people around. It's just not what you do. It's in my line of work, we do pig farms and chicken farms, and there's more biosecurity in a pig farm than what is in a hospital, which is pretty sad. It can do that with an animal, but they can't do it with a human being. And as I say, that should never have been done. And I say the social work department should have put their foot down, because they're supposed to protect vulnerable people.
And he died 2 days after testing positive, didn't he? And we know that the Midlothian Health and Social Care Partnership, their director Morag Barrow, is quoted as saying that you accepted his place onto a waiting list for Drummond Grange Care Home because he was identified as fit to move on. But you query that, don't you? You say that once that you actually said, no, we don't want him to move now. It's too dangerous.
No, I says to them, I says, you're sending my dad to the gallows. I says, you're going to send him on a death sentence. I says, because at the age he is, and he's and obviously he's in an environment with people, they're on their wee bubble together in the hospital, and you're going to send them into a new environment with different bacteria levels, and obviously there's people passing away on a daily basis in there. But the nursing home were trying to blame the hospital, and hospital were trying to blame the nursing home. It was like a tit for tat, saying maybe the test wasn't done properly, maybe the the testing kit was mixed up, and they'll just try to pass the buck for pillar to post.
So what do you want done now? Because am I right in thinking you believe both parties are at fault here?
My dad was supposed to get a care package. They were going to give him a care package before the pandemic, when they were going to send him, when they were going to move him just after Christmas when my mother passed away. And they were going to put this care package in, and the nurses were going to go down, and they were going to sit with them and get him eased in, do a kind of a transition over, a handover, and that never happened either. And as I say, that should have been put in place for him. As I said, they just took my dad out of there, and they just chucked him into that other home. And the ward that he was in, the empty, never ever got filled. It lay empty because they emptied that ward for obviously for to put COVID people for people who had COVID, and for recuperating that ward, and it lay empty.